Bismillahirrahmanirrahim. I am Dr. Muhammad SATTAR Ahmed. Today the case in this video is retention of fetal membrane or retained placenta, which is defined as failure to expel fetal membranes within 24 hours after parturition, usually within 3 to 8 hours after carving. This membrane is expelled out, but due to the deficiency of hormones, minerals, vitamins, and infection inside the uterus cause retain of membranes within the uterus, and till now the animal is not fully parturited, because after expulsion of fetal membranes, then we can call now this cow has parturited completely and now he is good health wise. So now if this appear in herd or in a single shed, we should wash properly with antiseptic lotion the portion of hanging out. But before this we should give sedation so that the feeling of pain should be decreased. After this we will wait few minutes, and now we shall wear gloves on our hand and cover the foot, because the material within the uterus is very dangerous. Many diseases can be transmitted through this contaminated fluid having the causative agents brucellosis, vibriosis. Now this is antiseptic. We can also use magnesium peroxide, magnesium permanganate, magsulf or alum. Now I shall try to expel the hanging material so that cow should feel easy. And after this, antibiotics, analgesics, antihistamines, multivitamins and mineral mixture should be given